So guys, let's talk about the blood supply of the face. In this part, we will be looking at the arterial supply of the face. We'll see how exactly facial artery terminates and with what it makes an anastomosis. Followed by that, we'll talk about the facial vein also. And not only the facial vein, we'll look at the venous drainage of the face and how together the tributaries are draining into the internal jugular vein and also formulating the external jugular vein. So let's start with the facial artery. Well, the course of facial artery, it can be divided in two parts. We got cervical part of facial artery and we have facial part of facial artery. The cervical course or cervical part or the facial part. And this has to be understood separately because facial artery in the neck is present within the deep cervical fascia. But we do not have deep fascia on the face except the parotid region. That means when the facial artery emerges on face, it need to pierce that deep cervical fascia and comes out. So what is that point where exactly facial artery emerges on face? That is a question here. So first, let us look at the course of the facial artery, and then subsequently we'll talk about their branches also and at exactly what point it emerges on the face. So let's presume this is the side of the face. And as we already know, facial artery is a branch, it's a direct branch from the external carotid artery. So here is the external carotid. One of the anterior branch of external carotid is facial artery. The level of beginning of facial artery is at the greater cornua of the hyoid bone. As a matter of fact, it is just above the greater cornua of the hyoid bone. At the level of greater cornua of hyoid is the lingual artery, and just above we have origin of facial artery. And sometimes, as we already said, that facial artery and lingual artery, they come out as a common trunk called as a lingofacial trunk. So you may see facial artery and lingual artery emerging, originating as a common trunk called as a lingofacial trunk. But generally, the case is if this is a hyoid bone, and let's presume this is a greater cornua of hyoid bone. So I'm drawing a line which is just above the greater cornua of the hyoid bone. Let me write that also. The origin of facial artery is just above greater cornua. Just above greater cornua of hyoid. Well, facial artery is having its course first in the neck region and the cervical region. Then it goes deep to the mandible where it supplies submandibular gland. And then it emerges from the lower border of the body of mandible. It runs very close to the angle of mouth, close to the ala of the nose, and then finally reaches the medial angle of the eye. So this part here, this here is the cervical part of facial artery. That is the cervical part of facial artery present in the neck. And as I said, from the neck region, it goes deep to this angle or the ramus of mandible, where it gives off the branches to the submandibular gland also. So if I point it out, guys, this point here is present deep to mandible. So it's not that the facial artery coming from the neck region and directly enters the face. It first goes deep to this body of mandible, angle of mandible, in fact. And when it goes deep to the angle of mandible, so it is situated between the mandible and the submandibular gland. So it goes between the submandibular gland and the mandible, where I said it supplies submandibular gland. And then the facial artery emerges on the face. Now, what is that point where the facial artery emerges on face? That is the anterior-inferior angle of masseter muscle. When you clench your teeth, the muscle that you feel on the side is a masseter muscle. Now, if you put your finger along the anterior border of masseter and keep dragging your finger and reach the lower border here of the mandible. So, anterior-inferior angle of masseter is the point where facial artery emerges on face. Or you can say facial artery is piercing the deep cervical fascia to come on face. So, here's the point where the facial artery, it pierces deep cervical fascia. And what is the point where it is piercing? It is the anterior-inferior angle of masseter. So that's an important question to be asked, that at what point the facial artery pierces the fascia, or you can say emerges on the face. In fact, facial artery pulsation can be felt here only. If you look at the facial artery, the place where it is against the bone, where can we feel the pulsation of any artery when it is present against any bone? Radial artery pulsation can be felt against the radial styloid because it is close to that part. Similarly, if you take any artery, the pulsation is felt against the bone. Same story here. Facial artery is present very close to the lower. It is basically winding around the lower border of the mandible, close to anterior inferior angle of masseter, and that is where you can feel the pulsation of facial artery. The cervical part of facial artery, if I just stick with this part first, the cervical part of facial artery gives off 4 branches. So there are 4 branches from the cervical part of facial artery, and those branches can be remembered with the mnemonic STAG, S-T-A-G, STAG. That's a mnemonic for the branches coming from the cervical part. Now, what does the STAG stands for? This S is for submental artery. T is for tonsillar artery, which supplies palatine tonsil. A for ascending palatine. Be careful, it's ascending palatine and not ascending pharyngeal. Ascending pharyngeal was the direct branch of external carotid. And G stands for the glandular artery, which supplies submandibular gland. So these are the 4 branches of the facial artery given off in the neck region, or you can say cervical branches. Submental artery, obviously we'll be reaching this submental region here, submental triangle. The tonsillar artery supplies palatine tonsil. Ascending palatine artery supplies palate, as well as again it supplies palatine tonsil. And glandular artery, it supplies submandibular gland. After that, when we set the facial artery, it reaches the face and runs very close to the angle of mouth and ala of nose. Now it gives off the branches in that region also. So apart from the muscular branches, it supplies obviously the muscles of facial expression. The 4 main named branches of facial artery are, we have a branch for the lower lip, that is inferior labial artery. For the upper lip, that is superior labial artery. For the ala of the nose, that is lateral nasal artery. And then finally, this is continuing as an angular artery, which is reaching the medial angle of eye. So this here is inferior labial. We got superior labial artery. That is lateral nasal. And here we got the angular artery. So these are the 4 branches of facial artery on face: inferior labial, superior labial, lateral nasal and angular. Lateral nasal and angular. So 4 named branches in the neck region, the 4 cervical branches. And as I said, these are the 4 branches on the face. So we call them the facial branches. These are facial branches. Please also remember that out of all these 4 branches, when I say lateral nasal artery, it supplies the ala of the nose. Now, this is not the artery supplying the lateral wall of the nose. When I say lateral wall of nose, I'm talking about the interior. It's the superior labial artery which gives off the branch which goes inside and supplies the nasal septum also. It contributes to the Kiel-Beck's plexus as well. This superior labial artery gives off the branch which goes and contributes to the Little's area. And that artery is called a septal branch of the superior labial artery. So, just an added point here, the superior labial artery, it also gives off the septal branch. Septal branch. And that septal branch contributes to the Little's area. How exactly facial artery terminates? Well, this here is the terminal branch of facial artery. It's not the end artery, it's just a terminal branch of the facial artery. And this facial artery, angular branch of facial artery, it ends by anastomosing with the artery called as the dorsal nasal artery. With the dorsal nasal artery. Dorsal nasal artery is a branch of ophthalmic. And as we all know that ophthalmic artery is a direct branch of internal carotid. Ophthalmic artery is a direct branch of internal carotid. So if you see this connection here, external carotid artery gave off the facial artery which reaches all the way to this point here. And internal carotid artery gives off the ophthalmic and then gives off the dorsal nasal artery, and that anastomose with this one. So basically, This here is an anastomosis between the branches of external carotid and internal carotid. This again is a good question to be asked, that which two arteries are participating in the and forming the anastomosis between ECA and ICA. So that is the anastomosis between ECA and ICA. Make sure we remember the name of the branches. So it's the angular artery and the dorsal nasal artery, the two arteries which participate in this anastomosis. So this is about the course and the branches of facial artery. As we said, 4 branches in the neck region and 4 on the face, and they do ask question about where it emerges and pierces the deep cervical fascia, and also about the anastomosis of the dorsal nasal branch. Now, what about facial vein? When we talk about facial artery and facial vein, we talk about facial artery is tortuous, but the vein is not. And the reason for facial artery being tortuous because it has to go through the muscles of facial expression and muscle of mastication. So obviously, when mandible is the only movable bone that we have in this region, and that obviously will put an undue stretch on the facial artery, and it can tear the artery. So that is why the facial artery is tortuous, because even if when the mandible is moving, when you're closing and opening of mouth is being done, so we still have that extra length of the facial artery which is allowing that expansion. Agreed. But why facial vein is not tortuous? I mean, if you look at veins are thin walled. So logically, veins should be more tortuous because they need more protection. The veins are not tortuous because unlike artery, facial vein is not running close to the angle of mouth or ale of the nose. When you look at the course of the facial vein starts from there as an angular vein only. And when the facial vein descends downward, it is not as anterior as facial artery is. So you'll be seeing facial vein is running behind like this, away from the angle of mouth and ala of the nose, and then it goes into the neck here. Once it reaches the deep cervical fascia, it's the same story then. The both are running together only. But on the face, facial artery and facial vein are not exactly corresponding. Artery stays in front and vein stays behind. So let's talk about the facial vein. And not only the facial vein, let's also look at the entire venous drainage of the face and how these veins are going down and draining into the internal jugular and external jugular vein. So coming to the venous drainage, well, let's go the same way. If you're looking at the side of the face, I hope you remember the nerves that we discussed when we said there's a branch of ophthalmic nerve called as a frontal nerve, and that frontal nerve emerges as supratrochlear and supraorbital nerve. Now, this term supratrochlear, supraorbital is not only for the nerve. We have the arteries with the same name, and we have a veins also with the same name: supratrochlear vein, supraorbital. So these supratrochlear and supraorbital vein, when we talk about venous drainage, obviously we have to start in the reverse direction. So supratrochlear and supratrochlear and supraorbital vein, they unite with each other, and they form an angular vein on the face, and which comes downward from the side of the face on the side of the face and continues as the facial vein. So what I'm saying is, guys, if this here is the supratrochlear, and let's say this is a supraorbital vein, they unite to form this angular vein, and this angular vein will continue in the face as a facial vein. Just drawing these arrows so that you remember the direction of the blood flow. So these are the two. You got a supratrochlear and supraorbital vein. This here is angular vein. The two unites to form the angular vein. And this angular vein will continue below on the face as facial vein. We already said facial vein is not tortuous like artery, and vein is running a bit away from the ala of the nose and the angle of mouth. Now, let me stop this facial vein here, and let's see what are the other veins coming from the scalp region and the rest of the face. So for that, guys, let's say if this here is the parotid gland, let me just put a parotid gland here. So this obviously will be the external auditory canal behind it. As we know, parotid gland inside is having a plane called as a Patay's fasciovenous plane. There is a Patay's fasciovenous plane inside the parotid gland, which is present between the superficial and deep part of parotid gland and allowing the veins and the nerve to go through it. The two terminal branches of facial artery, of the external carotid artery, was a superficial temporal artery and maxillary artery. So we have the veins with its corresponding name also. So we got a superficial temporal vein, which you'll see coming down in that Patay's plane. And we also have this maxillary vein coming in. Now this superficial temporal vein and maxillary vein, they unite and they form another vein which is running downward, and it runs downward behind the ramus of mandible. It runs behind the ramus of mandible, so we call it retromandibular vein. Let me write these names first. This is the superficial temporal vein. That's superficial temporal vein, and here we got the maxillary vein. And both these veins, as you can see, they're uniting and they're running downward. And when they run downward, they're running just behind the ramus of mandible. So obviously the name given to them is the retromandibular vein. I'm writing in short, you do the same only. Make sure you write this full form somewhere else. This is RMV, retromandibular vein. Makes sense? Retro, it's behind mandibular vein. And once the retromandibular vein, it reaches the apex of parotid gland, which is close to the angle of mandible only. It divides into two. The anterior division goes and joins with the facial vein, and posterior division, now look at this, the posterior division will join with the vein coming from behind the auricle. Now we all know what is the artery behind the auricle, that is posterior auricular artery. So obviously vein will be the posterior auricular vein. So this here is posterior auricular vein. So that's the anterior division of retromandibular, and this is posterior division of retromandibular. So you can see the anterior division is joining with the facial vein, and after joining with facial vein, it forms a vein called as a common facial vein. And this common facial vein is going to drain into the internal jugular vein. It's not the external jugular, it is internal jugular. The same internal jugular vein which was formed by the sigmoid sinus and inferior petrosal sinus. So that's the common facial vein. How it is formed? By the facial vein and anterior division of retromandibular, and then this common facial vein drains into internal jugular vein. The internal jugular vein which was present in the carotid triangle, in the carotid sheath. So there is the point where the common facial vein is draining. Whereas the posterior division of retromandibular vein joins with the posterior auricular and together gives rise to, both of these together gives rise to external jugular vein. That's the formation of external jugular. So here's a question again, that what are the formative tributaries of external jugular vein? I told you for all the major veins in the body, you need to remember at least their formative tributary, be it azygous, hemizygous, internal jugular, external jugular, how they're formed. So internal jugular vein, we already know they're formed by the sinuses, the dural venous sinuses. External jugular vein is formed by posterior division of retromandibular and posterior auricular when they meet, so they form external jugular. And this external jugular vein goes into the lower part by passing superficial to sternocleidomastoid and drains in subclavian vein. It drains into the subclavian vein. Internal jugular vein is content of carotid triangle, so it is obviously present deep, but external jugular vein is present superficial to this sternocleidomastoid. It will come downward in the posterior triangle and drains in the subclavian vein. So that is how that's how the facial vein is draining. So facial vein, as we said, how the facial vein is formed, it is by the angular vein, which is formed by supratrochlear and supraorbital, forms the common facial vein with anterior division, goes into internal jugular, whereas posterior division with posterior auricular forms external jugular, which drains into subclavian. Now this facial vein is having some deep connections also inside, which are dangerous connections, because the infection from the facial vein can go deep inside, so we call them the dangerous connections of the face. Now what are those dangerous connections? Let me just show it to you separately. Once again, if I just look at the side of the face, okay, Now, in the middle cranial fossa, cavernous sinus was present. In the on, on the sides of sella turcica, we have the cavernous sinus. So let's presume this here is the cavernous sinus, which is present in the middle cranial fossa. And I hope you also remember that the foramen which is present in the floor of the cavernous sinus is the jugular foramen. This is jugular foramen here, and that's the cavernous sinus you're looking at. If you remember, there was one of the tributary of cavernous sinus, which we said it is an incoming as well as an outgoing channel. It was an emissary vein, so it was an incoming as well as outgoing channel, and that was the superior ophthalmic vein. Now, guys, if this here is the angular vein, and then obviously it will go down as a facial vein. That's the angular vein, and of course, this one is facial. So one dangerous connection here is to the angular vein. There's a direct connection of cavernous sinus and the angular vein, that is through superior ophthalmic vein. The superior ophthalmic vein, which we said is an incoming as well as outgoing channel of cavernous sinus. So this vein is running through the orbit and it is outside connected to angular vein. So it's quite it's very obvious that because this being an emissary vein, so there are no valve inside. So infection from the cavernous sinus can go toward the angular vein, or from angular vein it can go toward the cavernous sinus. So any infection from the outside of the face from this angular vein region can reach the cavernous sinus because there are no valve inside. So this again is one of the dangerous connection. There's another dangerous connection we have. Cavernous sinus through emissary veins also is connected to a plexus called as pterygoid venous plexus. The plexus is present between the pterygoid muscle, so we call it the pterygoid venous plexus. This one here is a pterygoid venous plexus. Where exactly the pterygoid venous plexus is? It is in the infratemporal fossa. Once you remove the ramus of mandible, so you are in this infratemporal fossa where we have lateral and medial pterygoid muscle also. So it is the one which is present in between the pterygoid muscle, and it is also present within the substance of lateral pterygoid muscle also, this pterygoid venous plexus. This pterygoid venous plexus is having a connection with cavernous sinus through emissary veins. These are emissary veins again. The one that you're seeing going through the jugular, not the jugular foramen, sorry, this here is the facial vein having certain dangerous connection inside, and let's understand them on a picture. Once again, this is the side of the face, and let's say here we got the angular vein and the facial vein. Cavernous sinus is present in the middle cranial fossa on the side of the pituitary gland. So let's say this here is the cavernous sinus, and the foramen which is present in the floor of cavernous sinus, the foramen which is present or forming the floor of the cavernous sinus is allowing the passage of emissary veins which are connected to the plexus below in the infratemporal fossa, and this plexus here is called as pterygoid venous plexus. That is the pterygoid venous plexus. So here is the foramen lacerum which is present in the floor of the cavernous fossa, cavernous sinus, and then we have some emissary veins which are connecting the cavernous sinus to the pterygoid venous plexus. What is pterygoid venous plexus? These are the venous plexus which is present between the pterygoid muscle. In the infratemporal fossa, we have lateral pterygoid, medial pterygoid muscle. So in between the pterygoid muscles, we have that venous plexus, and this is having this emissary vein connection to that. Cavernous sinus is connected to this angular and facial vein outside. Now this is the angular, and here is the facial. So we do have a connection with the angular vein directly to the cavernous sinus, and we have a connection of facial vein to the pterygoid venous plexus, which again ultimately is going toward the cavernous sinus only, because both these connections are also emissary connections. They are emissary veins. They do not have valve. So guys, this is called as the superior ophthalmic vein. That is superior ophthalmic vein, and this here is deep facial vein. So they both are good questions to be asked. Superior ophthalmic vein is a dangerous connection because the infection from this angular vein region can reach the cavernous sinus through this valveless connection. And again, the facial vein is having a connection to the pterygoid venous plexus, which is in the infratemporal fossa, through deep facial vein. So this also is a dangerous connection of face. So these two, all these are emissary connections. These are emissary vein. I'm writing EV. That is emissary vein. All these are emissary veins which are connecting the cavernous to the pterygoid venous plexus, and this also is the emissary vein. And you know what are emissary veins? These are veins without valve. Veins without valve. So if the question is asked about the dangerous connection, go with the superior ophthalmic and the deep facial vein. And let's say in the MCQ, if you have to choose one out of the two, that which is a more dangerous connection, so you got to go with the deep facial vein. All the superior ophthalmic vein looks like a direct connection to cavernous sinus, but the most the infection prone region of the face is this part, lower part here, the dangerous triangle. This also is a acne prone region of the face as well, and that's why the more dangerous connection out of the two, although it is a sort of indirect connection to cavernous sinus, still the best answer is deep facial vein. Both, if you can choose both, nothing like that, but if you have to choose one option between the superior ophthalmic and deep facial, this has to be the best answer. So this is about the arterial supply and the venous drainage of the face, and about the deep connection, which are the deep dangerous connection.